Good morning. Next is the most awaited Professor Viswanathan Memorial Oration. There are quite a few surprises in the course of this program. Dr. Mohan probably is much more than an individual. So probably I will not introduce him, but I will define Dr. Mohan. He is well popular globally in every nook and corner of the world, and I have personally experienced that, not as Dr. Mohan, but as Dr. Mohan. And he is the godfather. He is the man behind who has elevated the status of diabetes in the country. And his untiring efforts all these years have elevated the status of diabetologists in this country. And I am extremely privileged and proud to welcome him over to the dais. And it is a dream come true for doctors in Kerala. Padmasree Dr. Mohan delivering an oration. And there is another surprise. This oration is in memory of his own father, Professor M. Viswanathan, a legendary personality who is considered as the father of diabetology in India, who started the first diabetes department at Stanley Medical College 1 year after India became independent, a milestone, a part of history of medicine in India. And he pioneered his efforts in research, especially in the prevention of diabetes. He again started the first diabetes clinic in India at Royapuram. And his efforts are being continued by the generations. And here, he's going to deliver his original research on prevention of diabetes, which will have profound impact on public health. And I respectfully invite Dr. Viswanathan Mohan sir.
Thank you, Dr. Jothydev, for that very generous introduction and for the kind words. Good morning to all of you. It's a great privilege to have in the audience my aunt, Dr.Subhadara Nair, younger sister of my father, Dr. Viswanathan, and the oldest member of the family, now alive, and so I'm great privilege to talk before her. Probably in all my life, the first time that I'm talking in front of my aunt. So I dedicate this talk, of course, to my father, who was not only my father, but my mentor. I had a unique opportunity, which I think very few doctors in the world would have had, and that is to start working with him when I was 18 years old, to start working with him actively in diabetes. In fact, I took up medicine only to work with him in his diabetes center. So that actually was a big bias. I went through the medical college, but also a great honor. And as Dr. Jothydev just mentioned, he is called as a father of diabetology in India. And he was far ahead of his time in his thinking. And if today I stand before you, it's because of him. I wanted to keep this as a surprise for my aunt. Now, this is an early picture of me with my father taken in Germany about 30 years ago. This is my grandmother, my father's mother, who was the first doctor in the family. She also belonged to the Stanley Medical College, that time called as Royapuram Medical School. The Stanley Medical College wasn't even started. So she was actually the first generation doctor, and then my father and aunt, and now me, and now my daughter, and so on. So several generations all started. This is my mother, probably taken at the time of their wedding. Auntie, I didn't even know when the picture was taken, but you can see, I think my aunt was then a medical student probably. She's also from Madras Medical College, my alma mater. And this is a picture with my aunt. Definitely like to thank Jothydev, his wife Sanita, and the whole team here for inviting me to be here today.
Ladies and gentlemen, it's our pleasant duty this morning to recognize the presence of Dr.Subhadara Nair, a very senior gynecologist of Kerala. Dr. Subhadra is an illustrious daughter of an illustrious mother Dr. Madhavi Amma, who herself was a very sought-after gynecologist during her times. That was a time when gynecology was not a specialty, and the profession, the medical profession, was not even very glamorous as it is today. She passed out from the Madras Medical College in 1952, and her brother, Professor Viswanathan M, offered her a job in Chennai. If she had accepted that job, you would have had another diabetologist, because diabetology runs in the family. There are so many diabetologists there. Even I think Pranav is, in due time, will become a diabetologist. Dr. Subhadara Nair passed out from Madras Medical College, and she joined Trivandrum Medical College in 1954. And she started her career as a tutor and retired as a head of the Department of Obstetrics and Gynecology and the director. She is now a third-generation gynecologist for many families in Trivandrum. And reportedly, Dr. Subhadara Nair holds the unique record, the distinction of having assisted over 50,000 childbirths. Dr. Subhadara Nair was born and brought up in a pre-independence India when patriotism was at its peak. And the best example was set by her mother, who insisted that the children wear only khadi. And they had charka at their home and ensured that they all knew how to make yarn from the cotton fiber, something which we have all forgotten. Such a childhood instilled in Dr. Subhadra the qualities of dedication to duty, compassion for the poor, and service to humanity. Her services were recognized by the President of India by conferring her with a coveted award of Padmasree in 2014. We will now honor her with a ponnada. I now request Srimati Sunita Jothydev, my daughter, to escort Dr. Subhadara Nair to the dais.
It was very kind of Dr. Jothydev to call me here, because I would have been a diabetologist if I had accepted my brother's invitation to join him. But somehow I had more affinity for the women who had come to me, and I felt rather close to them than to the subject as such. So I said, I don't want to be I want to be a gynecologist. I don't want to have anything to do with diabetes. So I left this institution from Madras, and then I came over to Trivandrum, and I joined the Trivandrum Medical College, and I thought I was very clever when I became a gynecologist. Now I feel I should have stuck on to my brother's invitation and joined the family as one of the people who can do something for the women who are associated with the diabetologist group. But even without me, they have done so well, and I don't think I could have done or associated myself more with the diabetology. And somehow I feel, I feel very proud that even if I left it, all the others have kept on with it and taken the institution to the high level that it is now. And almost everybody I see talk very brightly and very happy about the venture that they have done. And I thank them for taking up the effort of my brother and my mother. And I thank Dr. Jothydev and the associates for calling me here. And I thank the audience, august audience to have been here. And I wish to convey my thanks to you and my respects to you. Thank you once again.